Hello everyone, my name is Amanda, but I like to go by Mandy. I am in Dr. Clem's clinical group level 2, and this is my week 10 OB presentation on pelvic inflammatory disease. I had a nice presentation set up with pictures, everything I'm talking about on it, but I'm just having the hardest time with getting the sound to cross over to save, so this is my last resort. Bear with me. So our patient background in the case is a female patient presents to the emergency department reporting abdominal pain and vaginal discharge is observed. Her oral temperature is 103 degrees Fahrenheit. She says she's been experiencing frequent nausea and vomiting and that she has not been able to eat or drink as much over the past 24 hours because of her symptoms. She also reports increased bleeding with her periods as compared to her usual amount, and laboratory testing has shown a tentative diagnosis of PID, and she has been admitted for further treatment. So first and foremost, you want to know what is pelvic inflammatory disease. So pelvic inflammatory disease happens when a polymicrobial, which means just like multiple different bacteria, or sexually transmitted infection ascends from the vagina up to the uterus, the fallopian tubes, and the ovaries. It's very common and can result in serious reproductive health complications such as fibrosis, scarring, ectopic pregnancy, loss of tubal function, chronic abdominal pain, and infertility. Usually it's caused by untreated gonorrhea or chlamydia infections, but sometimes it can also happen without an STI being present, which I did read a little bit up on, but I need to read into it more. And it was just basically saying how something interrupts the normal flora of the vagina, and the same way it ascends up and causes PID. So of course, a patient who presents with pelvic inflammatory disease, it often, their uterus, their ovaries, their vaginal canal, fallopian tubes, it's all very inflamed. The walls can be thickened. You may see some abscesses in there, some pus, obviously the discharge too, as compared to, what's normal. You probably wouldn't see anything like that. So labs and diagnostics, what to expect, what should the nurse see? So there's actually no single test that can determine a diagnosis of pelvic inflammatory disease, but rather groups of testing that can support it. However, laparoscopy is considered the gold standard for diagnosing PID, but has its disadvantages as it requires general anesthesia. CT, ultrasound, and MRI may also be used to demonstrate the presence of any abscesses or of thickened fluid-filled fallopian tubes, which is what you would see. The nurse can also expect to find an elevated erythrocyte sedimentation rate, ESR, it's also known as, or an elevated C-reactive protein level, both which are part of the inflammatory process, and that's because obviously the body is trying to fight off the infection. Other labs can include a urinalysis, STI testing, which would show a positive result for either gonorrhea, chlamydia, or both, and often we learn that gonorrhea and chlamydia are BFFs, and usually if you have one, you have the other. They may also have a CBC, which can show an increased white blood cell count, or any other abnormal findings such as a decrease in hemoglobin could be related to the amount of blood they're losing because it's increased with PID. They may also have a saline vaginal smear, which is also called the wet mount, and that will present white blood cells on the slide. So next is what information would be important for the nurse to gather about the client. There's a number of important questions to ask the client. First, you want to obviously, ask the client's age. Are they in adolescence or young adulthood? Because it's more common that PID is in young adult women as compared to older. Do they have multiple sex partners that puts them more at risk? Did they participate in sexual activity at a young age? Do they have a history of PID or any other STIs that is shown? With STIs, you're more likely to get PID, and PID is also reoccurring. So if you had it before, you can have it again. Have they had intercourse or been exposed to someone who may have an STI? Are they using protection such as condoms or contraceptives? And are they being used properly? As we learned, how many times people aren't using a condom correctly, or not taking their birth control at the correct time or in the right time frame. And that can result in a multitude of mishaps. Also, are they experiencing any pain during sexual intercourse or having abdominal pain? You want to ask, are they having any pain with urination or experiencing painful periods? And you want them to describe their periods, such as how long it is and the amount of blood. Is it normal? Is it higher than normal? You also want to ask if they participate in any drug or alcohol use. How long have they been experiencing the nausea, vomiting, or fevers? And some other questions you can ask is, what is their ethnicity? I read in the book that it's more prevalent among young African American women or women from the Caribbean, anyone basically who's non-white. You also want to ask if the client smokes or participates in douching. Is the client nulliparous, which means, are they a woman that never had any children, or have they ever given birth? You also want to ask, have they had a recent termination in pregnancy, or are they involved in prostitution or being sexually trafficked, which I felt like that was an important thing to ask your patient. Because oftentimes, you might get a client that would come in who may be scared or embarrassed to talk about their situation. So you kind of want to get that trust with your patient and find out if that pertains to any of them, because that obviously puts them more at risk for PID. Next, you want to know what interventions would the nurse include in this client's plan of care. So you want to obtain baseline vital signs for the patient, especially monitoring their temperature, which in our case study, the patient did have a temp of 103-degree fever. You want to ask the client if they have any drug allergies, because most likely the plan of care will include administering an antibiotic for the PID or for the STIs, and any analgesics for the pain. You want to monitor and maintain the patient's hydration status with IV fluids due to the decrease that our patient had in nutritional/fluid intake, and the increase in her vomiting and nausea, because she could definitely be at risk for being dehydrated now, and electrolyte imbalances. Also, another thing is, if they are receiving these pain medications and these antibiotics, is to kind of monitor their bowel movements, their bowel patterns, because a lot of it can relate to diarrhea with the antibiotics or constipation with the pain medications. You also want to assess the patient's pain by asking about its characteristics, like its onset, its location, its duration, its exacerbating factors. Is it radiating? Are there any relieving factors? You want to you could facilitate pelvic drainage by assisting the patient into a semi-Fowler's position and noting the COCA of the drainage. Also noting, if they're obviously having a lot of drainage, you want to keep them clean and dry and to prevent any skin breakdown from it. Also, you want to assess the patient's abdomen by palpating over the ovaries and uterus and note if the client is experiencing any tenderness or pain in that area. Interventions. So, educating the client about pelvic inflammatory disease, its complications, and how to prevent reoccurrence is one of the most important things you can do. So, you want to explain to the client what tests are needed and why and how they are performed. You want to explain to the client that their partner should be included, if possible, in sexual counseling or to be tested for the STIs. Also, whoever they may have had sexual contact with should be informed to get tested. One interesting thing I found was a website called tellyourpartner.org. And what it does is you type in that person that you had sexual contact with, their phone number, and it anonymously texts them saying that they may have possibly been exposed to an STI and that they should be tested. I thought that was interesting and very helpful for if somebody's embarrassed about their situation. You also want to educate on the importance of limiting the number of sexual partners. They should be educated on the proper use of condom/barrier methods and to use them consistently. You also want to explain the importance of completing the full regimen of antibiotics prescribed and to not drink alcohol while taking them, and that they should take the full regimen because just because they feel better doesn't mean that it's been treated properly, and alcohol can obviously have bad side effects with antibiotics. Also, you want to educate the patient about the serious complications that can occur if they go untreated or they do not stick to their treatment plan, such as infertility, an ectopic pregnancy, or chronic pelvic pain. You also want to ensure to provide non-judgmental support to the patient. Put yourself in their shoes. You want to ask the client if they have any worries about their diagnosis or if they have any difficulty with discussing their situation to their partner or sexual contact. Also, you want to address if they have any financial concerns with receiving treatment or follow-up care, because that can also interfere with their treatment plan. And that's all I have. Thank you.